So let's talk about your calf. The calves are definitely an area full of stress. What a lot of us don't realize is the muscle called soleus, the fascia that is at the lower part of the leg, and the muscles that invest that lower region dive deep and create the plantar fascia in our foot. And for a lot of people, because of that poor posture with their pelvis tucked under and deviated forward, the lower leg sort of locks down and tries to hold and mediate the force of the legs so that the pelvis can stay in a relatively aligned position to the center of the foot. But because we have a lot of pelvic instability, a lot of us, that lower leg is so locked into place, it's actually disrupting pelvic positioning and ultimately creating low back pain. So if you are somebody with low back pain and you find that your calves are pretty sensitive, this would definitely be a key part of any melt math that you do. So in the calf, I usually in a class just pick 2 areas, but depending upon your time and what you were doing or what your focus was in your class, you could pick 3 areas. But what I usually tend to do is I have people start in the mid-belly of the calf where their feet are not touching the ground. So you'll see if I bring it up too high, my feet touch the floor. So you don't want your feet to start on the ground. So if you just push the roller a little bit down from where your knee is, where you're kind of in the mid-belly of the calf, and have that as your starting place, you'll always make more out of the move. Now you can do this move with both legs at the same time or one at a time, so I'll show you them both. So if I were going to glide on both of my calves at the same time, what I want you to see is how my knees just gently float up toward the ceiling and then back down. Nice and gentle motion. I also want you to see how the roller is staying in a relatively narrow region. It's just 1 or 2 inches. And actually, if you watch, the roller is actually staying in the same local region of my calf. It's not going up and down the whole plane of my calf, which is what people like to do. Or they say, oh, when I bend my knees, my feet hit the ground. I say, well, you're just moving too big. It should just be a nice small motion, just nice up and down, floating the knees. So remember, gliding, it's a preparatory technique, and it's a way to investigate the tissue for barriers. So the best thing you can do is just turn both legs a little to the left and sort of explore the outside of your left calf and the inside of the right calf. And then turn your calves over the other side and do that same gentle gliding over here. And you might find that as you move around, you want to almost immediately flex your feet, which is because it's sensitive. But if you flex your feet, you really are defeating some of the penetration of compression that you could create with the tissue. So if you want to just for a second try it, flex your feet and glide and just notice how you don't feel anything, and then allow your calves to relax and let the ankles relax and just kind of feel how much deeper you get into the fascial fibers. So really moving more slowly. So if you're gliding with both of the calves, just remember that the ankles stay relaxed, and you can explore the tissue by kind of turning both calves in or out, going in the same direction, or you could turn both calves outward and both calves inward to sort of find that area that you feel is sort of lumpy. And then to do the shear, you create either small circles with both of your ankles, or you can turn your calf in and out. But if you feel like you're going over a speed bump when you do that one, you're better off doing something more like cross friction like we did on the back of thigh, where you're sort of just sustaining your compression to create the pull. So if I cross my ankle over and I relax my calves again, I can create that same gliding just on one leg at a time. Now it does tend to get more intense, because you do have a little bit of added pressure on the bending when you bend your knee, which is sort of giving some of the compression more toward the front surface and top surface of the roller as you explore the tissue. So just be mindful if this was too much, just stay with working on both legs at the same time. But if you are working on one leg at a time, sometimes the best thing to do to support the pelvis is just to slip your hand into the opposite hip, or you could just put both hands underneath your pelvis, again like a triangle to support the sacrum as you create the glide. it'll just decompress the sacrum itself just by holding your hands here. Or what you can do is just take your hand underneath the opposite side so that it tends to rest you more on the buttock and off of the tail triangle or your sacrum as you create the gliding motion. So one or both hands is fine. And again, you just kind of swirl around this area, getting smaller and smaller and smaller in the motion till you kind of identify a spot you can tolerate your compression on. And then you shear. You just create small circles with your ankle, or you can flex and point your ankle, or you could rotate your calf left to right, or you could create a scratching motion. And then you just wait there for a second. Just give the tissue a moment to adapt. And then let's try it on the other side. So again, if I wanted to, I could just take both hands and just set them underneath my pelvis to create that nice gentle gliding across and around my calf. Or again, if I felt like I just needed a little bit of extra support, I just have my clients sort of lift and shift so that they're more on their buttock on one side, and then their hand supports the SI joint so that they don't have much disruption or compression to the tail triangle at all. And same thing, I just sort of explore the tissue here, finding an area that I want to tolerate the compression on. I get smaller and smaller and smaller, and then I just wait there for a second, and I either create small circles with my ankle, or I rotate my leg left and right, or I create that scratching motion. Any of those compressive forces will create that shear force or fluid flow exchange. And again, once you do it, you just wait. Now, one of the key things that I always talk about is the lower calf. So if I were to just take the roller and bring it even lower in my calf, where I'm really in that tapered point, not right at the edge of the tapering in this region of my calf, but really in this thinner region of the calf, if I do my gliding down here, some of you guys are going to find that it is awfully tender. And this is a good message to send people, is to explain to them, listen, if the lower calf is more tender than the belly, it's a good indication that you probably do have some stiffness in the lower leg, and that actually has a big relationship to your low back. So if you have low back pain and the lower calf is very tender as you glide, it's a good indication that this will be a part of your map. And then it's the same thing. You either shear by creating small circles or flexing and pointing your ankle, rotating the leg, or again, if that's too intense, you kind of create that shifting action. But remember, if you feel like, gosh, I feel that in my low back, just slip your hand underneath your pelvis to sort of stop you from shifting too far in the pelvis itself. And then you can wait there for a second. And then try it over onto the other side, and same thing, creating that nice little gliding motion. So if you feel any pressure in your sacrum while you do the lower calf, which is not uncommon, just encourage people to take both hands, slip them under their pelvis like a triangle so that their hands are supporting and contouring the sacrum itself for a moment as you create this gliding. And you do want to get in and get out of here. You don't want to be waiting too long as you create this motion. If you have any clients that suffer from vertigo or feel dizzy, or they just cannot find a comfortable spot, when you are on the lower leg, you can come up and lean back so that you're in this position. Just be mindful here, because you are working on the back line. You're causing a little bit of tension up above the pelvis and your shoulders as you create the gliding, but this would be sufficient. But what I would not do is I would not sit up to do this motion, because it does cause more tension to the tissue. You're pulling on it, so that you're actually going to increase pain but decrease depth of compression, because you're pulling and creating a resistant barrier to your glide or your shear. So always best, if you can, to lie down. And then same thing, you create small circles with your ankle, rotate your leg, or create a little bit of twisting, and then wait there for a moment. So remember, why you're working on your calf is, again, to help support stability and balance. What you're doing is creating gentle gliding and compression, shearing on the calf in 3 local regions. And then how you want to do it, remember, is if you need to, you put your hands underneath your pelvis. It's just a nice floating up and down of the knee. You don't want to get too invasive in the motion or too big. And the biggest tip, the most important thing, is to tell people to not flex their foot as they create the glide or the shear. You'll find a lot of people keep their foot very flexed as they do this, and there's a part of their mind that thinks that they're pressing harder, but actually remember, if you flex your foot, you're causing tension to the tissue, and so it will actually increase pain sensitivity, but you'll decrease the depth of compression. So make sure that you keep your ankle nice and relaxed as you do that. move.